Today we've got the wonderful Bianca Trimboli from the Calder Soccer Club. However, we're not at the Calder Soccer Club. We're actually at the home ground of the Galaxy as one of her opposition. So it's actually quite unique. Beautiful thing today is we've got Bianca here and she's actually got a little bit of gluteal and also an adductor overload. So we've got a little bit of work that we can do with her to try and free up these areas. So for some of you who have joined us before about our hip protocol, we're going to put some of it into place today for you. So let's start off. We've done a little bit of assessment with Bianca before we started, and what we found is that she's got a lot of soreness and I suppose a lot of tonicity in this upper part of her adductor longus, which is the most common muscle that gets overloaded in soccer, primarily because they're in external rotation as they're always kicking the ball, so it's always loading up that adductor longus. So the first thing we can do is we can have a look at a little bit of the range of movement. So I've noticed when I'm doing our internal rotation with Bianca that we tend to find that she's got a lot of restriction at her TFL, so that's another area we're going to look at in freeing up. When we did our groin strength test and obviously getting her to squeeze for us, she's feeling it all through that adductor longus. So these are the two areas we're going to focus on and try and free up her, unfortunately, sore groin. So to start with, we're going to bring the leg out, put the hip into a bit of flexion. As you notice, this is my favorite position. So as long as your clients or your athletes are really comfortable in terms of having both their leg and their hip in this position and not getting any pinching at the back, then this is my most favorable position. Otherwise, get them side lying on the table and you can do that. That's also very, very doable. Okay, so we're going to use a little bit of the lotion today because I'm going to probably cover a lot more areas than I specifically do when we're using obviously just the cream. So a little bit of lotion, really broad approach to begin with. Check out and see how much your clients can take that pressure. So as you can see, the adductor longus, the belly of the muscle's about here. So that's where she's feeling most of her soreness, okay? Coupled with the fact that she's also got some real significant tonicity in that TFL's area. Yep, so that's about as much as you can take there, isn't it, Bianca? So I'm just using a really broad approach, taking her up into hip flexion and adduction, just trying to challenge that tissue. Come a little bit more from the side, all the way up, and as we get up, obviously it's just that little bit more tender. So just ease your pressure off just that fraction, just so that I can just feel her starting to just tense up a little bit on me, but that's okay. Okay, so working through that area like so. Okay, so we'll bring her back down. So what I like to do is sort of trial treat, reassess, see how much we'll see how much change you've made. So we'll just get Bianca back into that squeeze position. Give us a squeeze now, Bianca. How's that feel? Yeah, a lot better. So okay, we would probably do that another 3 or 4 times.
If you like this video, press like and subscribe.